Assalamu alaikum. I am Fadwa, a master student in CRS program in Just University, and I am working as assistant teacher at Just. Today, me and my colleague maryamghazo will give you a lecture that's summarizing an article under the title Holistic Health Care. First, we have an introduction. Then we will talk about the models of illnesses, which include the biomedical model, the biopsychosocial models, and the holistic models of illnesses. Then we will talk about the healthcare system, and in the last we have a conclusion. The research question is: does ensuring that the initial clinical encounter with a specialist hospital service includes collection and concentration of information across all domains of the holistic model of illnesses lead to a better patient outcome? So, at the end of this lecture, which summarize this article, we will know if using the holistic model in the healthcare system will lead to a better patient outcomes or not. Holistic health care is perceived to be good both morally and practically simply because it considers and addresses all relevant factors to the person's illnesses. But it is difficult to find either any clear enunciation or mystification of what constitutes holistic health care or any clear explanation of its practical utility. So this paper aims to overcome these difficulties. Now, almost all healthcare practitioners claim to practice holistic healthcare. But what do they mean by being holistic? Or how they manifest their holism, what the definition or examples they provide to us. To make the picture clear, let's know more about the word holism. Holism, the tendency in nature to form wholes that are greater than the sum of their parts through creative evolutions. And in this article, some authors said that the word holistic is derived from the word wholes, which mean entire or all of. And the word holistic is synonymous with comprehensive. Holism was a part of a development in thinking in the 20th century that led to theories of complexity. And as we know, the biomedical model doesn't acknowledge the complexity, and this model emphasizes the unidirectional relationship or simple cause and effect relationship. But the holistic model, which acknowledges the complexity, emphasizes the fact that relationships in many systems are not linear. There is no simple relationship between cause and effect. There are many factors contribute to the development of an illnesses, as the holistic model said. Over the time, holism has become increasingly popular within healthcare. So a lot of association emerged, like the British Holistic Medical Association, the American Holistic Medical Association, and the American Holistic Health. What about the holistic medicine? Holistic medicine is the art and science of healing that addresses the whole person, body, mind, and spirit. With the term holistic medicine now seems to encompass two separate concepts. The first concept is close to the original meaning, referring to a comprehensive analysis of illnesses considering the whole systems. It recognizes that illnesses or being sick is a human phenomenon and that a full understanding and analysis of illnesses requires a broader perspective than simple focusing on disease. The other more recent meaning is that of using an alternative approach. Alternative to what? Alternative to the traditional biomedical approach to illnesses. So, the holistic medicine takes into account the whole systems and then work on understanding and analyzing the all relevant factors contribute to the development of an illnesses. And in the end, the holistic healthcare emerged. And the holistic healthcare refers to an approach to analyzing illnesses and providing healthcare that acknowledges and responds to all factors relevant to the health or illnesses of a person. Now, we will talk about the models of illnesses. We have the biomedical model, the biopsychosocial model, and the holistic model. Why do you think a holistic model of illnesses is needed? In the other word, why they develop a model for holism? Simply to judge whether a particular approach or organization is providing holistic healthcare or not. Okay, how can we measure the degree of holism underlying a professional or organizational approach? Simply by comparing the particular model used by the organization and with the standard holistic model of illnesses. The first model, the biomedical model. The biomedical model, it arises from the scientific method of investigation, which simplifies and reduces the complexity, looking for direct cause and effect relationship. And it assumes linear unidirectional relationship and doesn't acknowledge the complexity as we said earlier. This model has several weaknesses because the underlying assumptions all are invalid. It assumes that all illnesses start with a disorder within the body, causing bodily symptoms that lead to disability and restriction on social life. But in fact, not all illnesses result from a disorders, and not all disorders result in bodily symptoms, especially in what it's called functional illnesses without specific disease, like chronic low back pain. A lot of people have low back pain, but it doesn't mean that all of us have a disorder lead to a low back pain. So this model fails to explain these illnesses, and it is not successful when designing healthcare systems. Nonetheless, the biomedical model has been a successful model for about 150 years. It has allowed the identification, classification, and rational treatment of a huge number of diseases. Is the biopsychosocial models and was so named because it recognized the importance of biological factors, psychological factors, and social factors. So it addresses the all relevant factors that contribute to the development of an illnesses. And this model, it was first used by the WHO in the development of its first classification, which is consequences of disease. And this model is an alternative model that acknowledges the importance of factors other than disease, suggests a systems approach to illnesses, and it has been used as the basis for an international classification system. Thank you for your listening, and maryamghazo will continue.
Assalamu alaikum. My name is maryamghazo and I will complete this PowerPoint. First, I will talk about the holistic models. The holistic models of illness that is based on and derived from the WHO ICF classifications of the consequence of disease. Holistic health is actually an approach to life rather than focusing only on illnesses or parts of the body which are not well. Holistic health considers the whole person and how he or she interacts with his environment. It is about the connection of the mind, the body, and how he or she interacts with his environment. It is about the connection of the mind, the body, and the spirit to achieve maximum well-being where everything is functioning to best as possible. The model suggests that there are four levels or systems centered on the person that are relevant to illness. It should be noted that each level can in principle at least subdivide into two perspectives, that of the person and that of external observer. The first system to be considered is that of an organ or organ system within the body of a person. The next system is that of the whole person, to include both bodily and mental domains. It is the overall functioning of all the different organs and organ systems present within the body. The next system to consider is the person's interaction with the physical environment. This consists of the person's activities, the behaviors that they undertake, usually to achieve various goals. The final level is the most abstract and the best considered as the person's interaction with the social environment. It refers to the roles that they play. These four levels are concerned primarily with the person. It is worth restating that only activities are externally observable. Impairments are deduced from observations of behavior and/or reports from the person. Disease is initially diagnosed on the basis of a characteristic pattern of abnormality, sometimes confirmed by direct observations of the organ. Social participations and rules are also indirectly inferred from observed behavior. The model then recognizes four factors that may moderate the interaction between the four systems. These contextual factors may themselves also cause alterations directly in any of the four person-centered systems. The first contextual factor is personal, that means the observable environment. Social means the local cultural environment. Personal, the sum of person experience and personality. Temporal, both the stage a person is within the illness and the stage the person is at within their life. We already explained this slide and the next two slides in the figure. There are two major factors that need to be included in any comprehensive model of illness: the person's free will, their ability to make choice, the person's judgment on their own level of well-being or quality of life. Choice is important. It is generally agreed that all people can make choice and responsible for their behavior. Quality of life is another concept that is important but difficult to define or measure. It is ultimately a judgment made by the person about their situation. It is probably influenced by many factors, including personal preference. A holistic model suggests that illnesses is a socially determined state requiring four steps. First step, an experience that is outside of normal. The second step, without any obvious external cause. Third step, it is attributed to an internal cause within the remit of healthcare. The fourth step, accepted by others as being the situation. Now predicts that illness will arise when first the external or internal demands changes within a person exceed the capacity of that person to respond or adapt to the changes or demands. Third, leading to symptoms or experience that are attributed to disease. Now we will talk about the healthcare system. Healthcare is best considered as a problem-solving process with different parts of the healthcare system focusing on different aspects of illness and sometimes having different goals. All healthcare system process will have the following general structure. The first step is for the patient to present to healthcare system. Usually this will be initiated by the person. The next step is for the healthcare system to collect information to establish first that there is needed any problem present that is appropriate to healthcare. Second, what other healthcare problems exist. Third, information needed to identify the causes of the situations. The finally is information needed to identify the best treatment. The next step is to use the data collected formulate the case, specifying the nature and extent of the problems and the causes and factors relevant to management and resolution of the problems. The fourth step is to use the information to set management goals. The potential goal fall into one or more of the following three categories. First category is provide support. The second, undertaking treatment. Third, collecting more data. The next step is for the planned actions to occur. These actions, especially treatments, are often considered the main parts of the healthcare process. In the sixth step, the situation is re-evaluated to determine whether first, treatment goals have been met, second, further problems needing more action have been identified, third, any problems remain needing treatment, finally, longer-term support needs, if any, have been identified and the plans made to meet these needs. The seventh and final step is no further problems remain to be resolved by the particular parts of the healthcare system is for the patient care to be transferred away from the system. The options are to transfer care to first, a more specialized service if problems remain which could be resolved given more specialized input. Second, a less specialized secondary care system. Third, primary care, community care. Fourth, the patient and family self-management. If all clinical staff and all specialist services use a holistic model of illness when undertaking their initial formulation, it is likely that clinical decisions would first be more appropriate, considering all relevant factors, second, be more patient-centered, considering the person's own views, third, include an early referral to an appropriate rehabilitation service. The conclusion. Finally, a holistic approach and healthcare can help in understanding and management of the problems faced by individual patients. And it emphasizes that in most illness there are many factors that may contribute to the person's experience and that may be amenable to change when helping the ill person. And it also predicts that in some people illnesses may arise without any disorder within the person. These are functional illnesses, and it's emphasized that Most people within complex and or long-term condition will need multiple intervention from many professions working for different organizations over long periods if we are to achieve the best outcome.